Hello, I'm Anita Moore, Chair of the Premier Health Board, and I'm honored to be the Executive Chair of this year's African American Wellness Walk. Established in 2000, the African American Wellness Walk is back for its 21st year. It was started to raise awareness and combat the heart health disparities that affect African American communities and has since grown to address the alarming number of health conditions and socioeconomic disparities that plague our families and friends in the minority communities that we serve, especially during the ongoing COVID-19 pandemic. This year's walk's theme is Walk in My Shoes, and it offers an opportunity to demonstrate compassion and understanding for those with backgrounds and experiences that differ from our own. We ask all community members to come together in solidarity and participate in the walk, extending special invitations to our law enforcement friends, communities of faith, and our youth. Our locally led board is comprised of members who live in our communities and see firsthand how coming together is vital to support our ongoing commitment toward improving health outcomes in African American and minority communities. I'd like to take a moment to commend the African American Wellness Walk Committee and our Premier Health employees for helping to make this year's walk a success. Thank you for your participation and your dedication to improving the health of the communities we serve. Now, I would like to hand the post-race experience over to Stacy Lawson, Chief Human Resource Officer for Premier Health.
The African American Wellness Walk started some 20 years ago, and it started on the basis of really us examining the heart health of African Americans. And what we knew at the time was that African Americans had a higher rate of cardiovascular death as it relates to heart attack and stroke. And so it started there, but it also started not just from the recognition of the prevalence of cardiovascular disease in the African American community, but it also caused us to take a look at heart health walks and the participation of African Americans in our community. And that's where we saw a need. So it was several individuals it was a community-based walk, and it was several individuals that came together that said, how can we prioritize African American health? And at the time, as I indicated, we were looking at it through a very narrow lens, but we were looking at it broadly because before we heard the terms health inequities or health equity or social determinants of health, we were already on the path of really examining how we could improve the health of African Americans. So through the Premier Community Health Mobile Clinic, we have established some partnerships with Home Full Grocery, Mobile Grocery, and through that I'm so excited to share with you that we have served nearly 70% of African Americans, and we have targeted that and we have narrowed that down to zip codes within the African American community and Dayton community that have particularly been food deserts. So that is one of the ways in which we are continuing our support. So again, this is about lifestyle changes. And so when we are serving in that way and we're looking at lifestyle factors and we're looking at food choices, that is a way that we continue our efforts to serve the African American community. Another tangible way that we are continuing to provide support in the African American community is just the vaccinations. And when you take a look at the vaccinations, the screening, the education, the support that we have continued to provide. Now granted, that has been through partnerships because it takes a village. And so that has been a way that we are continuing our efforts to educate the community about why it is important that we are vaccinated.
COVID-19 causes more harm to communities of color.
More hospitalizations, more deaths, more exposures.
This virus is a threat to us.
The COVID-19 vaccines work.
Scientists of color and clinical trial participants of color
have been key to making it a reality.
We can trust these vaccines.
That's why I chose to get vaccinated.
The other area that I think is really important for us to highlight is our barbershop initiative. And through our barbershop initiative, again, we are providing monthly education and screenings at several locations throughout the community. And that has been one of the ways that we have been able to get into the community and serve our community and be responsive to community needs. Next, I'd like to introduce Dwayne Martin, my friend, my co-worker. He has also been truly instrumental in the progress that we have made on our African American Wellness Walk. He has served as our co-chair, and he also serves as our Vice President of Corporate Compliance for Premier. So please join me in welcoming Dwayne.
Thank you, Stacy. I'm Dwayne Martin, Executive Co-Chair for the African American Wellness Walk and the Chief Compliance and Enterprise Risk Officer for Premier Health. On behalf of the African American Wellness Walk Committee, congratulations for completing the 2021 walk. This year we had over 1,700 participants from 41 states and 6 countries. Whether you chose a 5K or a 10K walk run, bike, or the social justice challenge of 9.29 miles in honor of George Floyd, your participation helped in our mission and commitment to raising awareness to healthcare inequities in the African American community. Yet, hundreds of people have signed up, which is a testament to each participant's willingness to make a difference for the African American community. Thanks to your generosity, we've raised more than $35,000 to fund nonprofit organizations who are addressing social determinants of the health and African American community in our region. This year, we have raised more than $61,000 through donations by our sponsors and participants, surpassing our expectations. We would like to thank the following sponsors. Thank you so much for your willingness to participate in this year's African American Wellness Walk. Next, I would like to introduce Adrian Taylor, Director of Diversity at Premier Health.
Thank you, Dwayne. Hello, everyone. I am Adrian Taylor, Director of Diversity at Premier Health and a member of the African American Wellness Walk Committee. Thank you for joining us for the post-race virtual experience. In the midst of the dueling health and racial pandemics impacting Americans, the mental and physical health of African Americans has become a central focus. Social determinants of health are a direct contributor to the overall health of African American communities. In a 2020 report titled The Demographics of Racial Inequality in the United States by Brookings.edu, we learned that 1 in 13 Black adults were not able to see a doctor or go to the doctor in the past 3 months because they couldn't afford it. 1 in 90 Black babies would die before their first birthday. 1 in 2,060 Black mothers would die while pregnant, during childbirth, or shortly thereafter. 1 in 1,000 Black men and boys would die at the hands of police. 1 in 10 Black adults were not able to pay rent or mortgage in the past 3 months. 8 in 10 Black adults with at least some college experience report having experienced racial discrimination at least from time to time, including 1 in 6 who say this happens regularly. It's because of statistics like these and others that Premier Health has been committed for more than 20 years to raising awareness and helping African American communities become healthier. This year, we have specifically raised money to support nonprofit organizations that are addressing social determinants of health and some of the other inequalities that I've already mentioned. So again, thank you, not only for your participation and your charitable giving, but for all you've done to help us be successful. We are looking forward to the 2022 African American Wellness Walk.
set, take.